Prostate Cancer Awareness Month, followed by Breast Cancer Awareness Month in October. And the staff at Middlesex Hospital want to make sure you know your options and have the correct approach to your cancer care. Joining us today to let us know about all the new techniques at Middlesex Hospital is the Oncology Chair, Dr. Anwar Khan. It's great to have you here.
Thank you.
So talk to me how the approach to cancer care is a little bit different at Middlesex.
So Middlesex Hospital tries to be very competitive, bring in the new technologies as they become available to make sure our patients are getting the best that is out there.
Right.
So in particular, I'm the radiation oncologist. I'll talk about it. There are two new technologies that we have recently implemented.
Okay.
One of them is for prostate cancer patients. Radiation therapy has a very strong record. It's one of the two modalities that's used for treating prostate cancer. Surgery is the other one. And when it comes to radiation therapy, we use these machines called linear accelerators. They've come a long way too over the years. They can pinpoint where the prostate is and deliver the dose to the target, and cure rates, depending on the stage of disease, how quickly we diagnose, could be as high as up to 90%.
Wow.
So that really works wonders, basically.
Sure.
It's non-invasive. It doesn't require any procedures to be done. Patients just have to come in and out, and they can, during that time, live essentially normal lifestyles. The new product that I would like to introduce, which we're using at Middlesex System, actually, at both centers. We have the main campus in Middletown, and the other one is at Shoreline, is the new center we opened about a year ago. It's called SpaceOAR System.
Okay.
What that does is it creates a little space between the prostate and the rectum. It's a hydrogel that's injected around the prostate, and the key advantage is rectum tends to be more sensitive to radiation therapy than the prostate is, and the amount of dose that's necessary to kill the cancer cells could potentially cause some side effects. By creating this temporary space, you separate the two organs and you're able to get through with minimal side effects. In fact, we're able to accelerate the treatments and give even more dose than we used to do.
Wow.
So it's working very well.
And what is the response with patients? I'm sure they're
So
ecstatic.
patients are absolutely, I mean, we just began implementing it not too long ago, but so far the folks who are in the process of getting it, they're ecstatic.
Right, and I also understand that there's a new technique when it comes to breast cancer treatment as well.
Correct. There are parallels between breast cancer and prostate cancer. It's important to note, prostate cancer is #1 cancer in men. There are about 160,000 cases per year in the United States. Breast cancer is #1 cancer in women. There are about 250,000 invasive breast cancers diagnosed in the U.S. per year. And both of them, unlike some of the other cancers like lung cancer, which is driven by smoking, they are related to patients' behavior. Cervix cancer is related to human papillomavirus, a virus. These two both are kind of driven by body's hormonal levels. Estrogen drives breast cancer, and testosterone. There are some other things too, like family factors.
Hereditary as well?
Absolutely,
Yeah.
that's a big factor. When it comes to cancer, genetics play a big role, and age of the patient plays a big role. The older we get, the more likely we're supposed to get cancer. So for breast cancer, again, the treatment approach is generally surgery is #1, and then you add radiation therapy. We have decades of data. Radiation lowers the chances of recurrence after you've had surgery by about 70 to 75%, so it's highly effective.
Sure.
Now, what we in the past did was treating with left-sided breast. Sometimes there's a little difficulty depending on the patient's anatomy. The heart may be a little too close, and it used to get a little bit of random dose. So similar concept as we did for prostate. This new technique, DIBH, deep inspiration breath hold, what it does is anatomically, when a patient takes a deep breath, there is a temporary separation between the chest wall and the heart.
Okay.
So we utilize that principle. Our machines, it's a very fancy product that works with the linear accelerators, and it's computer-based. What it does is it synchronizes the machine to the patient's breathing.
Wow.
When the patient takes a deep breath during the inhalation, that's when the radiation is delivered, and then it turns on and off constantly as the person's breathing. So it's transparent to them.
Wow.
The end result is we spare the heart more.
Sure, so precise. Doctor, thank you so much for explaining the new techniques over
Absolutely.
at Middlesex. And again, you have a location on the Shoreline now.
Correct.
And you're also in Middletown.
Absolutely.
Very good. Thank you so much for being here. Of course, you can log on to middlesexhospital.org for additional details.